Hello, and thank you for watching the first Zebinar. This one is on the pandemic, but before I get started, I just want to give you a briefer on what exactly a Zebinar is. So at the moment, I'm just pre-recording these, and then as the campaign progresses, as we get closer to the election, I'll start to do them live. But what I want Zebinars to be pretty much civil discourse, a chance to educate voters on the issues, have a more in-depth conversation about it, really give my opinions on them and show my commitment to the cause. Because many people claim that they advocate for something, but they don't actually show that they've taken the time to learn about the issues. So as a small campaign, I just feel it's imperative that I give a bit of my 2 cents on the matter. So a standard webinar will be I go through the issue of the week, give my say on the matter. Then we'll open it up for a panel discussion. We'll do that for about 10, 20 minutes, and then open it up, open forum, and have people ask questions and engage in discussion on Zoom. But again, that'll probably happen after April 7th. So I'm just recording these now just to give a nice little portfolio before we start. But as I've said, this week we're going to focus on the pandemic, and just a quick clarification. Throughout this, I'm going to refer to it as SARS-CoV-2 because that's the actual name of the virus. It's the Severe Acute Respiratory Syndrome Coronavirus. So you see CARS, Severe Acute Respiratory Syndrome Coronavirus, COV, and it's 2 because the first SARS virus, if you don't know, originated in China in the early 2000s, and this is the second one. They're very similar. So SARS-CoV-2, the pandemic. COVID-19, that actually refers to the disease that you develop once you contract the SARS-CoV-2 virus. So COVID-19 is literally the coronavirus disease discovered in 2019. So just want a quick clarification for that because I just think it's appropriate that we speak in clear and accurate terms. So here you'll see a quick rundown of what we're going to go through. Part 1 is going to be a flashback, just go through a brief history. Part 2 is going to be where we're at currently. And I'll talk about current policy, current facts, all of that stuff. And then part 3 is a future worth fighting for. So you'll see that on the top of my website. It's kind of like a quasi slogan because it's not really a slogan, but it kind of is. And that's pretty much where I go through my policy preferences and my outlook on the situation. So here I want to start off with a flashback, and these are just some pictures just to remind us where we were in March of 2020 when city streets were empty, hospitals were flooded with patients because we didn't know how to treat the virus, and literally wildlife returned to places that humans usually have occupied. So I want to start off here with a world in chaos. And I've already gone through the SARS-CoV-2 and that naming. So again, this is a coronavirus. There are about 7 that are known to infect humans. The original SARS virus, the Middle Eastern respiratory virus, MERS, that occurred in like the mid-2000s. And now we're up to SARS-2. And pretty much the virus first emerged in November of 2019. Wasn't getting much headlines. We remember that China was trying to tamp it down, lied about a virus actually infecting people. Remember the WHO came out and said there had been no evidence of human-to-human transmission, even though hundreds of people were getting sick in China, and that contradicted everything we were seeing with our eyes. But that pretty much continued until February of 2020, when the coronavirus started popping up in different countries outside of China. And then in March, remember, that's where the world started to take it seriously. We didn't know how to treat it. People were still dying in hospitals. Hospitals were beginning to be overrun. So we started to implement lockdown policy because that was literally the only way to stop this virus that no one had any level of immunity to from burning through our population and forcing our hospitals and medical systems to shut down. Once we got into summer 2020, though, it started to ebb and flow, and different variants started to pop up. So there was the original one, and then alpha, beta, and so on until we got to Omicron, where we're on now. And in the winter of 2020, that's when we hit the biggest peak. It was when we still didn't have vaccines. It was when we kind of knew how to treat it, but many of the therapeutics weren't yet approved by the FDA. And winter 2020 was probably the darkest period in the entire pandemic. Unless things really go south, nothing is going to replicate what happened then. So, for the most part, the worst is behind us. So, I just talked about this a little bit, but I wanted to give kind of a visual to what happened. So, the original coronavirus emerged in November of 2019. And then the WHO and scientists around the world discovered the alpha and the beta variants. The alpha variant was first discovered in the United Kingdom. The beta variant was first discovered in South Africa. They had two dips, and I'll get into those later, or on the next slide. They had two big peaks. That's the word I'm looking for. They had peaks, and then they had dips with each variant that came through. And then Gamma was discovered in Brazil in early January of 2021. That one didn't cause a big uproar, but the one that did was Delta, which was discovered in May. That one wreaked havoc across the world because it was more transmissible and more deadly. And then we saw the Omicron variant emerge, and that was towards the end of 2021, the end of last year, and that is the wave that we are just leaving. So again, I want to give visuals to what these variants caused and to actually look at the world graph to understand that the variants and the mutation of this virus is what's pushing it along. If this virus wasn't mutating at such a rapid rate, it probably wouldn't be this bad. But you can see here where we discovered alpha, where we discovered beta, right here. And this is in the midst of this wave. So this wave was probably still going along with alpha, beta, and the original virus as they were competing for dominance. Then you get here to gamma. And again, gamma didn't cause that big of a problem at the time. It really didn't spread outside of Brazil. But then we get to Delta. And as you see here, vaccines had already rolled out once Delta came around, but since it was so transmissible, it was shooting through the unvaccinated population. And then once we get here to Omicron, we can see the difference in what that did compared to everything else. And it's one of the things that we have to be very thankful for, that Omicron was not as deadly as any of the previous variants of this coronavirus, of SARS-2. Because had it been as deadly as, say, Delta, with this peak here, millions more people would have died. But that wasn't the case. Omicron was much, much more mild. And as we look at the emergence of each variant, we have to take into account how bizarre mutations are with this virus. Because here is Omicron. This is all Delta. So Omicron didn't pop out from Delta's mutations. Omicron traces its original, like its heritage, all the way back to March of 2020, when this pandemic first started. So Omicron was swirling around this entire time for a year and a half, not infecting anyone, probably mutating in a small population, and then it just burst out onto the stage. And the reason this is important is because this could happen again. Now, I'm not a scientist. I didn't go to school for epidemiology, is that what it's called? Virology. So I can't say this with authority, but looking at this map where we see beta started from here, Delta started here, Omicron starts here. The major variants, they all trace back to the first few days of the virus. So is there another variant still circulating that hasn't yet pierced the global population? We don't know. And we have to be cognizant of that going forward so we develop actual policy that keeps people alive. But what I talk about is the failure, because this pandemic did not have to be as bad as it was. Because in the beginning, humanity had this perceived invincibility. And I remember it very well. You can look at China telling the world that, oh, it wasn't that big of a deal. You can look at when cases started to be discovered in California, how people in the United States were saying, oh, still go out, still see your friends, don't do anything bad, this isn't going to be a big deal. And 2 years later, we realized, yeah, it was a big deal. Had in those early days we taken this virus seriously, we may not be where we are now. And it's an issue that we had a lack of a coordinated response, a coordinated global response where the entire world said, hey, Let's coordinate our lockdowns. Let's coordinate our vaccine distribution. Let's coordinate everything that's associated with the pandemic so we strike at its heart every time. Instead, every country took its own policy, and then within the United States, every single state developed its own policy. It was a patchwork that was doomed to fail. But looking at these maps at the bottom, on the left-hand side, you have a map of the industrialized world, so what they call the global north in blue, also including Australia. The purple countries are the countries that aren't quite as developed as Europe, the United States, and Australia, so white countries. That's purple, but they're more developed than the global south. And the global south is all of these red countries you see here that are pretty much rampant with poverty. And once you look at the map on the right, which is basically a color-coded map of where the pandemic hit hardest, you realize this is more of a pandemic of the industrialized world. Granted, across the continent of Africa, across the global south in general, they lacked the resources to test accurately. So maybe a whole bunch of cases did fall through the cracks, but I'll get to that more later. So now I want to go through our domestic response here in the United States. As I said, it was led by the states. There was no major federal action. The biggest thing we got from the federal government was funding and Fed policy. So they dropped interest rates, added liquidity to the market. All of those things made money very easy to come by. Under Trump, we had the CARES Act, which was passed early on in the pandemic. We also had the supplemental package that was passed later on in the year after the 2020 election, I believe. And we had Operation Warp Speed that helped develop a vaccine. That was under Trump. Then under Biden, we got the American Rescue Plan, which is still paying dividends today. A across-the-board huge investment in the United States, unprecedented, as they like to say. And Biden was also responsible for vaccine distribution. So that was pretty much the domestic response. That's kind of a quick flashback to the pandemic. So let's talk about now, and let's talk about the issues that we're going through at the moment. And this is embarrassing, to say the least, but I'll let the numbers do the talking. Excuse me. So these numbers are adapted from World Infometer. It's not the most accurate source of coronavirus data, but it's what I've been using this entire pandemic, and it pretty much lines up with everything else. So we're seeing there are about 400 million cases, documented cases of the coronavirus, and about 6 million deaths. At the moment, reports are saying that death toll could be 3 times higher, if not more. I'm pretty sure that it's a lot higher because when you look at this, right, so what you're seeing here when you look at this is a graph of the confirmed deaths in gray versus the excess deaths in red. That red line is very confident, and then the further you get away in those lighter reds, that's less confidence. But at the bottom, you see it split up. So pretty much here, Europe, United States, Oceania, the global north, you see that deaths kind of matched up to their excess deaths. So the reporting here was accurate. When you get to Latin America and the Caribbean, again, reporting is largely accurate. When you get to Africa, it's like no reported deaths. Even still, you can see there aren't that many excess deaths on the continent of Africa. But when you get to Asia, and this is probably mainly China because we all know they covered up large portions of the pandemic, that's where you're seeing more of the deaths, more of the excess deaths, more of all of the destruction that the pandemic brought. But at its core, what I want you to see from this is, again, this map here. Because we know China lied about its data, so we can't trust it. And we know that during that early period, the coronavirus was swirling around, killing people, and no one was testing for it in the beginning. So that's why you see, again, a large number of excess deaths. Again, especially right here in this period in the early part of 2020. Looking at this map, there's something different that's happening in the industrialized world versus the rest of the world. And I've read through lots of things about what that could be. Think about the fact that there really is no enclosed buildings in the global south. Being outside is a whole lot more normal than it is, say, here in the United States. One of the things that we're focusing on is better ventilation. You don't really need ventilation when there's no AC and you have open air where the air can just blow through. So that's one of the things that people aren't getting the same viral load that they are in the United States, because you go into a restaurant here in the United States, it's completely shut off from the outside world. All of the virus that you're breathing is staying inside that room. If you go to somewhere like Cambodia, for instance, it's a whole lot more open air that's flowing through buildings. They have open windows. They don't have ACs. And that's partially due to them being poor, but we're looking at what is different about these countries in the global south and the other countries in the global north, because there's something intrinsically different that caused this pandemic to hit hardest up here, where all the white people are, where the industrialized world is. Something is different. But now that we're at a point that we have to figure out how do we live with this virus. And I know some people don't like saying living with this virus, but since we screwed up in the first few days, eradication is out of the question. That's never going to happen. We're never going to eradicate this virus, especially considering the political nature that it's taken on fighting the virus. Mask mandates are receding, so we have to come up with a way that people feel comfortable going outside, re-engaging with the world, and not fearing for their death. And so the policy initiatives that you see is Biden pursuing $30 billion more in coronavirus funding. Now, Congress didn't approve this when they passed the bill earlier last week that also included aid for Ukraine, but we need it because, as we've seen with these variants, once it goes quiet, there is always a chance that it could come back up again. And everyone wants to put this pandemic in the rearview mirror, but we can't, because that's exactly happened with the summer of 2020. Everyone said, okay, it's fine, and then Delta showed back up and just ravages the population. And everybody was like, oh man. And then as Delta receded, everyone said, okay, maybe it's over. And here came Omicron. So what's waiting now? Is there going to be a variant that is pretty much immune to all of the therapeutics, vaccines, and everything that we have developed thus far? Likely? No. Possible? Yes. It's biological Russian roulette. And honestly, it's not a game that I want to play. I'd rather us just be prepared for what could happen rather than sitting back and waiting to see what happens. Because we've seen what that wait and see game does. It kills millions of people. And at the moment, we're looking at the Omicron subvariants that are now taking over Omicron. They're even more transmissible. So the virus has not stopped mutating. It's not dying out. The only thing that's different is population is gaining an immunity. But as Omicron has shown, the variants are completely capable of evolving so that they can evade our immune systems. It's possible. So we have to keep that in mind going forward. So the question is, what do we do about it? What would I do about it? And I think it's honestly pretty simple. First, we need a clear plan for surges. We know this virus comes in surges. When it's not here, everything is okay. When it is here, it's a hellhole. So we should be stocking medical supplies. Again, this is part of Biden's $30 billion. So he is advocating it. Congress just did not authorize those funds. We need more N95 masks. 3 masks per person, that's great, that's nice. That's not enough to actually fight off this virus. We know that cloth masks are beneficial, but do they work like an N95? No. We also need emergency testing procedure. Again, these labs have other things to do when we're not in the midst of a coronavirus surge. They're putting everything else on the back burner. So why don't we come up with a policy so when surges come, we know when to have a 24-hour workforce in a lab, so that we're constantly testing. So people aren't waiting 2 weeks to get their test results. Because if you have to wait 2 weeks to get your test results, you might as well not even get a test. That's just the harsh reality of it, because your quarantine is up. We need to look at school closures. One of the things schools could have done these past 2 years is only teach when it's not a surge. We all know when a surge is coming. We see the little line in the graph starting to tick up. We know when a surge is coming. We could simply close schools then. Stop trying to virtually teach students. Stop trying to plan to teach students through surges. Just switch it to a year-round long program where when it's not a surge, kids are in school. When a surge comes, close it out. And just keep going back and forth until the pandemic is over. That would save a whole lot of people headaches. We'd be able to plan for it better, and people wouldn't be left out on a limb. But one of the main things is that there's a social contract. There's a virus that is capable of killing people or leaving people with lifelong disabilities. And it's a social contract for people to go out in the world and to expose themselves to that risk. And are some people willing to expose themselves to that risk? Yes. Are some people not? No. We need to develop something that allows a happy medium between the two. And I don't really see that being done. It's kind of a this or that. You wear your mask, you get your vaccine, you get your boosters, or you don't. And there is a medium in between the two. So for our domestic initiative, we need to make sure that having had COVID is a pre-existing condition that is covered. We don't know the long-term consequences of this. We've seen heart issues, brain fog, developmental delays. All of these things 10, 20 years from now, if they come back up, if they persist and they don't resolve on their own, we need to make sure that insurance companies don't look at these people that have contracted the virus, especially the essential workers that were working during this whole thing, and then they don't have healthcare coverage to get themselves the medical care that they need. So we need to make sure that having contracted COVID is a pre-existing condition that is covered. We need to take stock of our pandemic response. We need an investigation to figure out what went wrong and when, so that when the next pandemic comes, because it is coming, it may not come in our generation, it may not be the next, but a pandemic is going to happen again. We need to make sure that we have viable policies so that we're not in a shit show like this again. Millions of people died for no reason. And that all goes back to healthcare reform, because we've seen that for-profit hospitals do not entertain the public good at all. Overrun hospitals in the richest country in the world, that's absurd. It should have never happened. We should have had beds for people. If that means building hospital wings that we don't activate until we need them, so be it. But we need to reform our healthcare system so it's actually caring for people's health and not just building a profit. And lastly, we need to make sure that we have assistance for the people that are behind the numbers, because there are children that have lost both parents, lost their caregivers, now have lifelong disabilities. There are adults who can't go back to work, people suffering from long COVID. Imagine how sickly your life is when you get a horrible cold and your throat is sore for like a week. You can't talk, you can't enjoy your food. It's miserable. But in a few days you'll be fine, so you stick through it. I cannot imagine what it's like to just have a minor cold for over a year. I saw a report of a woman who killed herself because she had long COVID. And I'm not promoting suicide or anything, but we have to think about that this virus is so impactful to people that they're willing to end their own lives, end their own suffering to escape. We need to make sure that we're caring for these people. No ifs, ands, or buts. I don't care if you were an anti-vaxxer or not. I don't care if you didn't want to don your mask or not. No one should have to go about their life suffering when we have the means to take care of them. But it doesn't stop just here at home. We need to engage in a global initiative. As we've seen, these variants are popping up all over the world. The UK, South Africa, Brazil, China, all across the world, these variants are emerging. So we need a global vaccination campaign. We've wasted so many doses in this country because people didn't want them. Meanwhile, they are clamoring in the global south for vaccinations. Why are we not giving them? Why have we not donated enough? Now, you can sit back and say we've donated over 1 billion vaccines, but is the world vaccinated? Yes or no? The answer continues to be no, so that means we're not doing enough. Pats on your back to everyone who is trying. I get it, but we need to focus on results, not just words and promises. And lastly, we must develop a variant surveillance system. South Africa was brilliant in their ability to detect Omicron at such an early stage. I mean, as it was literally starting to emerge across the world, South Africa was already letting us know this variant is here, it's coming, get ready. That was a huge problem with so many other variants because by the time we discovered them, they were already showing up in other populations. So we need vaccine surveillance, making sure that countries around the world have the technology and the resources to sequence these viruses to discover when a new one is popping up, what it's susceptible to get it in the lab and test it to make sure that our vaccines, our therapeutics, all of that still works. So that's pretty much it. So I'm just going to leave it on a final note. And since this is my first Zebinar, one of the reasons that I chose the pandemic is one, it's still present in our lives, day in, day out. But also, the pandemic has showed us that we lack the coordination, the empathy, and the willingness to work with each other to fight a common evil. It is evidence that we don't have what it takes to fight climate change, and that there needs to be huge cultural, political, and social changes in order for us to confront the big three. And now is the time to learn from our mistakes. And if we fail to learn from our mistakes, we're going to be in this situation again, and it does not have to be that way. I don't want it to be that way. I'll fight tooth and nail to make sure that it is not that way again. But I'm only one person, and I'm vying for this seat. So if you support me, continue to check out everything that I have coming out. And again, I thank you for coming to the first Zebinar. Bye-bye.